Do you know what diabetic neuropathy is and how it affects our body? Let's begin our exploration into this fascinating yet challenging medical topic. Diabetic neuropathy is a type of nerve damage that can occur in individuals with diabetes, a condition that affects approximately half of the patients within 10 years of the onset of both type 1 and type 2 diabetes. It's a complex and multifaceted disorder with three major types. First, we have peripheral sensory neuropathy, which primarily affects the nerves responsible for sensation. Then there's motor neuropathy, impacting the nerves that control muscle movement. Lastly, we have autonomic neuropathy, which affects the nerves controlling involuntary body functions. Each of these types manifests uniquely with different symptoms and effects on the body. Now that we have a basic understanding of diabetic neuropathy, let's delve deeper into its pathophysiology. Stay tuned as we unravel the intricacies of this condition in our upcoming segments. Ever wondered how diabetic neuropathy develops in our body? Diabetic neuropathy, a type of nerve damage that can occur with diabetes, is a complex condition and its mechanisms are not fully understood yet. But let's delve into what we do know. The common forms of this condition, peripheral sensory neuropathy and motor neuropathy, are believed to be related to metabolic or osmotic toxicity. This toxicity can stem from increased levels of a sugar alcohol called sorbitol and/or decreased levels of a compound called myoinositol in our bodies. Now, why is this important? Well, high blood sugar levels in people with diabetes can lead to an overproduction of sorbitol while simultaneously draining the nerves of myoinositol. This imbalance can cause the nerves to become damaged, leading to neuropathy. But there's more to it. Other potential culprits in the development of diabetic neuropathy include the accumulation of harmful substances known as advanced glycation endproducts or AGEs, oxidative stress, activation of a signaling molecule called protein kinase C, and deficiency of nerve growth factor. AGEs are proteins or lipids that become glycated after exposure to sugars. They can affect nearly every type of cell and molecule in the body and are key factors in aging and chronic diseases like diabetes, atherosclerosis, and high blood pressure. Oxidative stress, on the other hand, is an imbalance between the production of harmful free radicals and the body's ability to counteract their harmful effects. It's believed to be one of the mechanisms underlying diabetes and its complications, including neuropathy. Protein kinase C is a family of proteins that regulate various cellular functions such as cell growth and differentiation, gene expression, and cell survival. Its overactivity has been linked to several pathological conditions, including diabetic complications. Lastly, nerve growth factor deficiency can lead to the degeneration of nerve cells, contributing to neuropathy. To sum up, while the pathophysiology of diabetic neuropathy continues to be a subject of intense research, understanding these potential mechanisms can help us in the early detection and management of this condition. Understanding the pathophysiology can help us in the early detection and management of diabetic neuropathy. How do we detect the onset of diabetic neuropathy? Excellent question. The key is in the screening and detection methods. With diabetic neuropathy, it's all about catching it early, before it has a chance to progress and cause further complications. For starters, we use a 128 Hz tuning fork or a 10-gram monofilament. These simple yet effective tools can help us identify the early signs of sensory loss. The tuning fork checks for vibratory sensation, while the monofilament tests for touch and pressure sensation. Now let's talk about screening frequency. For people living with type 2 diabetes mellitus, screening should begin right at diagnosis and then continue annually. Why? Because neuropathy can develop at any point once diabetes is present. For those with type 1 diabetes mellitus, the timeline is a bit different. Screening should start after 5 years of having the disease. This is because neuropathy rarely occurs within the first 5 years of type 1 diabetes. So, you see, the key to managing diabetic neuropathy is vigilance. Regular screening can help spot the onset of this condition, allowing for early intervention. And remember, early detection isn't just about preventing neuropathy. It's about managing your overall health, controlling your diabetes, and maintaining your quality of life. Early detection can help in better management and prevention of complications. So, let's remain proactive in our healthcare and remember, it's never too early to start screening for diabetic neuropathy. What are the signs that suggest one might have diabetic neuropathy? In our journey to understand diabetic neuropathy, we know it's not just one condition, but a group of nerve disorders caused by diabetes. These disorders present in various ways, and today we'll delve into the symptoms of its three main types: peripheral sensory neuropathy, motor neuropathy, and autonomic neuropathy. Let's start with peripheral sensory neuropathy. This is the most common type, and it primarily affects the legs and feet. Symptoms may include paresthesias, which are sensations of tingling or itching, neuropathic pain, radicular pain, and numbness. There's also a noticeable decrease in tactile sensation, making it harder to perceive vibration and changes in temperature. The symptoms are usually bilateral and symmetric. A decreased ankle reflex might also be observed during physical examination. In some cases, these symptoms may first occur in entrapment syndromes, such as carpal tunnel syndrome. If left untreated, it may result in neuropathic ulceration of the foot, a severe and painful condition. Next, we have motor neuropathy. This type is less common than sensory neuropathy, but still significant. It is characterized by delayed motor nerve conduction and muscle weakness or atrophy. It may involve one nerve trunk, a condition known as mononeuropathy, or more, called mononeuritis multiplex. Some of the motor neuropathies may spontaneously resolve after 6 to 8 weeks, but not all do. Diabetic amyotrophy, which refers to pain, weakness, and wasting of hip flexors or extensors, is also a manifestation of motor neuropathy. Last but not least, we have autonomic neuropathy. This type affects the autonomic nerves that control the heart, bladder, lungs, stomach, intestines, sex organs, and eyes. Symptoms may include postural hypotension, tachycardia, decreased cardiovascular response to the Valsalva maneuver, gastroparesis, and alternating diarrhea and constipation. It may also cause urinary retention and erectile dysfunction. In summary, diabetic neuropathy is a complex condition with a wide range of symptoms that can affect various parts of the body. Being aware of these symptoms is crucial, as early detection can lead to more effective treatment and better management of the condition. Remember, these symptoms are not exhaustive, and if you suspect you or someone else may have diabetic neuropathy, a visit to a healthcare professional is strongly advised. Knowing the symptoms can help in early detection and treatment. How can we manage and treat diabetic neuropathy? The first line of defense in managing diabetic neuropathy is maintaining tight glycemic control. This means diligently monitoring blood glucose levels and making necessary dietary and lifestyle adjustments to keep these levels within a healthy range. It's all about managing the root cause, diabetes, to mitigate the progression of neuropathy. For neuropathic pain syndrome, several treatment options are available. Tricyclic antidepressants such as amitriptyline are often used, offering relief by blocking the pain signals to the brain. Pregabalin and duloxetine are also commonly prescribed, both of which work by interfering with the pain signals sent to the brain. Antiepileptics like carbamazepine and gabapentin, originally developed to treat epilepsy, have been found effective in managing neuropathic pain. Capsaicin, a compound found in chili peppers, can also be used topically to relieve pain. But managing diabetic neuropathy isn't just about pain relief. It's about preventing further complications, and that's where foot care education comes in. Patients need to understand the importance of regular foot checks for cuts, sores, or blisters that may go unnoticed due to decreased sensation. Early detection and treatment of such issues can prevent serious complications like ulcers and infections. To decrease symptoms of orthostatic hypotension, measures like wearing JobStar-fitted stockings and tilting the head of the bed may be recommended. These simple interventions can greatly improve a patient's quality of life. And let's not forget about the gastrointestinal and urinary symptoms. Gastroparesis can be treated with domperidone and/or metoclopramide, medications that stimulate the muscles in the gastrointestinal tract. For urinary retention and erectile dysfunction, a combination of medical, mechanical, and surgical treatments may be utilized. In short, the treatment and management of diabetic neuropathy is multifaceted, requiring a comprehensive approach tailored to each patient's unique condition. It's not just about managing pain, but also about preventing complications and maintaining a good quality of life. Proper management and treatment can help diabetic patients lead a normal life despite having diabetic neuropathy. To summarize, diabetic neuropathy is a complex condition with various types and symptoms. It affects approximately half of patients within 10 years of onset of both type 1 and type 2 diabetes. It's crucial to understand that this condition can manifest in different forms, be it peripheral sensory neuropathy, motor neuropathy, or autonomic neuropathy. Screening for this condition should be done at the diagnosis stage and annually for people with type 2 diabetes, and after 5 years for those with type 1. The symptoms can range from tingling sensations to muscle weakness and even autonomic dysfunction. Treatment and management focus on tight glycemic control, pain management, foot care education, and treatment for any related conditions such as gastroparesis or erectile dysfunction. Remember, early detection and proper management can help in controlling diabetic neuropathy. Stay healthy.